And what would you never get?
A BBL.
Why?
Because they really don't look that great, honestly, and they cause blood clots, and they have the highest risk.
Risk of what?
Death.
Sure, everybody in the office is going to say this, but I would never have a BBL, A, because it's super unsafe, and we don't know the long-term effects.
I would never have under-eye filler done.
Why?
Because it doesn't sit directly on the bone, so it has the ability to migrate, and it can cause blistering, and with the weather, I feel like it fluctuates and it swells, and people are just not happy with the results.
I would rather donate some of my assets than enlarge them.
What fat necrosis is, it's kind of, so fat necrosis, the necrosis part of the word means death. And so fat necrosis means some of the fat has died. Now, we all know that when we have a BBL, not all of the fat that I place in the butt or in the legs or in the hips or in the hip dips, not all of that fat will survive. And if the fat completely resorbs, so it completely dies, then your body just absorbs that fat, and you really don't have any problem. It's kind of when you get into this little situation where the fat doesn't do well, it's not surviving well because it's not getting enough oxygen, and it dies, but it dies kind of slowly, and it's kind of, it's like a plant that gets a little bit of water, but not quite enough water to survive, so it kind of starts to wilt and turn brown. That's how I kind of imagine fat necrosis. And when your body does that, it places calcium into that area of fat. And so that area can kind of get white and a little bit firm. And if that fat necrosis is deep enough in your body, it just becomes this firm little ball. It's about the size of a black-eyed pea or a grape, or it can get even larger size of a golf ball. And that just kind of stays deep in the tissue and doesn't really present much of a problem. You might be able to feel it if you're sitting. You might not. And that type of fat necrosis, we really don't do anything about. We just leave that be. You can't see it. It typically doesn't bother patients. And even if we were to try to go in to get it, it would make a divot or a dent or some problem. And it's really not that easy to find something in the body that's of that size anyway. So with that type of fat necrosis, we just leave it alone. We really don't do anything about it. The other type of fat necrosis, which does require some attention, is if that fat necrosis is more superficial. So if it's higher towards the skin, what will happen is that fat necrosis will try and kind of work its way out of the body, and it starts to kind of push up, and it'll create a wound. And this is really easily confused with infection. And I would say almost every single patient that I've had with fat necrosis always contacts me saying that they have an infection. Or they'll even go to the doctor, hospital, and they'll be diagnosed with an infection. And it's really not an infection. It's fat necrosis. It's that fat that just didn't get enough oxygen to survive in its new location. And so that fat will die, it'll become calcified, and your body will just kind of extrude it. And so as it does that, the skin will get red, it'll hurt, and it looks like an infection, and then all of a sudden you'll see some of that white tissue coming through. And sometimes people mistake that for pus, but it's not. And then you get that little white area that comes through, and it really looks bad, I have to tell you. It's really quite shocking to patients. And that's why it's important to keep in touch with your plastic surgeon if you have fat necrosis, because if you go to your family doctor or the emergency room, they're not really going to know what it is. And they might end up just taking all of that tissue out, which is kind of what you do with an infection. And you're going to be left with a big hole. So the best thing to do is actually just soap and water and just allow your body to get rid of it. Sometimes there's some creams that we give you to help with that. And it just takes time. It takes probably about 6 or 8 weeks for that tissue, for the fat necrosis to come out, and your body will heal over. And really, patients usually don't even have much of a scar afterwards. So it's a type of thing that really looks bad at the beginning and causes a lot of panic and a lot of excitement. But if you're just careful, you know what it is, you follow it along and you treat it conservatively, meaning we don't go in and do something drastic and remove all that tissue, that will end up healing fine. So that's fat necrosis. There's other, so if you think of it this way, there's other complications of grafting fat, of putting fat into the butt. So one is that fat can just go away. That's resorption. The other is the fat can develop that fat necrosis, which I just talked about. Another thing that can happen is something called an oil cyst. And this happens much less frequently than the fat necrosis. But what that is, it's kind of a similar phenomenon in that that fat will not survive. And, you know, a fat cell is just a cell membrane with oil in it. And so if that fat cell doesn't survive, though that membrane there just will dissolve, but it leaves the oil behind. And so you can get an accumulation of oil. And usually this shows up where you have like a noticeable swelling on your butt, or it typically happens in the hip. And you'll see like a big area, it's kind of like a little, you know, like a little outpouching that comes. It looks like an abscess, but it's not red, it's not hot, it's not painful. It usually happens much later in the healing process. Infection is typically kind of the 2 to 4 week mark is when that presents itself, whereas an oil cyst is usually more 2 to 4 months down the road. And so what we do with that is similar to kind of how I treat a seroma, and I just take a needle and I place it in and I withdraw the oil, and it just looks exactly like, you know, olive oil or some type of cooking oil. And usually once we remove that oil, then the shape goes back to normal. Occasionally, we might have a little indentation there, which we'll have to fix later. Remember, anything that we're going to revise, we do it after 12 months because the tissue has to heal and it has to soften. So if there's a little depression made in the hip from an oil cyst, then I wait for a year and then I'll come back in and see if we might have to put a little bit of fat or something in there. So those are kind of the complications from grafting the fat itself.
Please like and subscribe. For real, subscribe.